yung nagiging epekto ng birth control, pero sabi po dito, yung mga babae po na gumagamit ng spermicidal agents for birth control, they are more at risk for developing or for acquiring UTI po. Yun. Aside from gender po, we have conditions like urinary tract abnormalities or yung ano po, tawag dito, yung urine po natin, condition po siya kung saan yung urine po natin is hindi po siya normally na nai-excrete sa katawan natin. Or ang nangyayari po, yung urine is nagba-back up dun sa urethra. Next is blockages in the urinary tract. So, dun po sa blockages, kapag meron po tayong kidney stones or enlarged prostate po. Kasi pwede po siyang mag-trap ng urine natin sa bladder. Next is suppressed immune system. So, alam naman po natin na kapag immunocompromised, mas at risk po sa infection. So, example po ng condition kung saan suppressed po yung immune system natin is diabetes po. Next, catheter use. So, ito po yung mga taong may conditions na nagre-require ng catheter use. So, example is people with neurological problems or those that are paralyzed. Kasi po, di ba, pag meron kang neurological problems, meron pong difficulty sa pag-control ng, sa pag-urinate. Then, kapag paralyzed naman, syempre, yun. So, next po is yung recent urinary procedure. So, yung mga patient po na nag-undergo ng urinary surgery o kaya po yung exam ng urinary tract kung saan gumagamit po ng medical instruments. So, precipitating factor, sexual activity, then perpetuating denial of symptoms, deprived resources, and poor hygiene. Next po. Signs and symptoms naman po. A variety of signs and symptoms are associated with UTI. So, first, burning on urination or dysuria, frequency or voiding more than every 3 hours, urgency or yung sensation ng kailangan agad na mag-urinate, then nocturia or awakening at night to urinate, incontinence, suprapubic or pelvic pain, and hematuria or blood, then back pain may also be present. Sa acute UTIs naman po, ito yung common symptoms. Chills, fever, leukocytosis or high white blood cell count in the blood, bacteriuria or presence of bacteria in urine, pyuria or urine containing white blood cells or pus, low back pain, flank pain, nausea and vomiting, headache, malay, and painful urination. Sa chronic UTIs naman po, usually merong fatigue, headache, poor appetite, polyuria or frequent excessive urination, polydipsia, excessive thirst, and weight loss. Diagnostics, urine cultures. So, UTI is diagnosed by bacteria in the urine culture. So, yung urine culture po, it is especially useful for identifying the specific organism present. So, doon po malalaman kung E. coli po ba yung nag-cause, STI, or Klebsiella pneumoniae. Then, cellular studies, dito po makikita kung merong microscopic hematuria o yun nga po kung may blood sa urine and yung pyuria po. Next, creatinine clearance and blood urea nitrogen. So, alam naman po natin na yung creatinine tsaka yung BUN, isa po siya sa mga tinitignan natin or nagiging basis po natin para makita yung kung maayos po ba na nagfa-function yung um, kidney. Yon. Other studies, leukocyte esterase test and nitrate testing, computed tomography. So yung computed tomography po, it may detect pyelonephritis or abscesses. Then ultrasonography, it is extremely sensitive for detecting obstruction, abscesses, tumors, or cysts. Transrectal ultrasonography, it is used to assess the prostate and the bladder. So yung transrectal ultrasonography po, ano po siya? Procedure of choice for men with recurrent and complicated UTIs. Next po. So yung medications po sa UTI, antibiotics po. So drugs commonly recommended for simple UTIs include trimethoprim, sulfamethoxazole, fosfomycin, nitrofurantoin, cepalaxin, and ceftriaxone. So kung makikita niyo po dyan, yung nilagay po ni Milky is yung may included po na ibang generations ng antibiotics. Pero may nabasa po ako na yung fluoroquinolones daw po, such as yung ciprofloxacin and levofloxacin, hindi po siya commonly recommended para sa simple UTIs. Kasi daw po, yung risk daw po ng medicines, yung, di ba, pag pag mag-a-administer tayo ng gamot, dapat wini-weigh muna natin or tinitimbang muna natin yung risk and benefits. Pero yung fluoroquinolones daw po, kung sa simple UTIs, mas malaki daw po yung risk kesa dun sa benefits. Kaya hindi po siya commonly recommended. So, pinaprescribe lang daw po yung fluoroquinolone kung walang other treatment na kung walang other treatment, kung walang other possible treatment. Yun. Symptoms may clear up within a few days of treatment, but you may need to continue antibiotics for a week or more. Take the entire course of antibiotics as prescribed. So, yun, dapat po lagi natin tandaan. So, yung ano po pala, yung reseta po ng doktor sa antibiotics, depende po. Usually, meron pong nagbibigay ng 3 days, meron 7 to 10 days. Depende po kung tawag dito. Depende rin po sa findings. Doon po sa mga diagnostics po na binanggit ko kanina. Yon. Aside po doon, meron din po tayong medication for pain. May analgesic po na binibigay. Next po. Assessment, signs and symptoms. So yun po, the presence of pain, frequency, urgency, hesitancy, and changes in urine are assessed, documented, and reported. The patient's usual pattern of voiding is assessed to detect factors that may predispose him to UTI. Infrequent emptying of the bladder, the association of symptoms of UTI with sexual intercourse, contraceptive practices, and personal hygiene. The patient's knowledge about prescribed antimicrobial medications and preventive healthcare measures is also assessed. Additionally, the urine is assessed for volume, color, concentration, cloudiness, and odor, all of which are altered by bacteria in the urinary tract. So, ang mga pwedeng nursing diagnosis po is acute pain, deficient knowledge, impaired urinary elimination, infection, and disturbed sleep pattern. Planning. Relief of pain and discomfort, increased knowledge of preventive measures and treatment modalities, achieve normal urinary elimination pattern, demonstrate behavioral techniques to prevent urinary infection, improvement in sleep and or rest pattern. Intervention: administer analgesic agents to help relieve pain and spasms, educate the patient about self-care, encourage the patient to drink liberal amount of fluids. Water is the best choice. Encourage frequent voiding every 2 to 3 hours. Suggest drinking of cranberry juice 4 to 6 hours, ounce of glasses per day. Reduce reduce environmental distractions such as noise and light. Evaluation: patient relieve pain and discomfort as evidenced by zero rate of pain in a scale of 0 to 10. Patient verbalized some preventive measures like practicing careful personal hygiene, increasing fluid intake to promote voiding and dilution of urine, urinating regularly and more frequently, and adhering to the therapeutic regimen. Patient achieved normal urinary elimination pattern as evidenced by absent sign of urinary disorders, urgency, oliguria, and dysuria. Patient is free of urinary tract infection as evidenced by the absence of fever, chills, flank pain, and suprapubic tenderness, clear non-foul smelling urine, and a normal WBC count. Patient report improvement in sleep and rest pattern. Pwede ba lakihan yan? Nasa-zoom pala. So, yun, classmates, pa-zoom na lang po. So, first po, sa pathophysiology is so yon merong contamination. Pero usually dapat state muna dan 'di ba yung risk. So yung mga nabanggit ko sa risk factors kanina, yun yung mga pwedeng mag-cause ng contamination. So bacteria contaminates the lower urinary tract. So what are those? Yung mga bacteria ngayon. So usually po sa lower urinary tract is yung E. coli. Then pwede rin po yung Klebsiella pneumoniae. Tapos yung mga nabanggit ko nga po kanina ng mga STI. So next, pag nagkaroon po ng contamination, magkakaroon ng colonization. E. coli initially colonized the urethra and the bladder. This triggers an inflammatory response in the lower urinary tract. And because of that, neutrophils are then recruited to these areas. Dito po muna tayo sa pababa. So, nagkaroon po ng contamination. Next, nagkaroon ng colonization. Nag-triggers ng inflammatory response. Then, nag-release po siya ng neutrophils. Bacteria multiply and they are able to invade the immune system. Doon po kasi sa bladder, di ba, nandun po yung bacteria. Naandun din po yung neutrophils. Ngayon po, yung bacteria po dun sa bladder, magmumultiply po siya. Then, magbabind po siya dun sa mga cells ng lower urinary tract para po, makapagtago siya dun sa mga immune cells natin. Nasaan ako? Okay na pala. Then, next po is, the bacteria can form biofilms. A biofilm is any group of microorganisms in which they stick to each other, and often these microorganisms adhere to surfaces and allow them to survive. Then, if this urinary tract infection progresses and left untreated, or if the patient is immunocompromised or has risk factors, the bacteria can ascend towards the kidney. So, from the bladder po, pwede pong mag-travel yung bacteria towards the kidney. So, yung lower urinary tract, pwede siyang mag-progress to upper urinary tract. And then, colonizing the kidney, causing an upper urinary tract infections. And then, from there, kapag hindi pa rin po siya na-treat, bacteria can spread into circulation via the renal veins, causing worst case, septic shock or bacteremia po. So, balikan po natin yung inflammatory response kanina. Aside po sa pagre-release ng neutrophils, yung cytokines po, marirelease siya systematically. Then, pwede po siyang mag-cause ng fever, malay, elevated WBC, nausea, and vomiting kapag po yung lower urinary tract is nag-progress na to upper urinary tract. Then, pwede rin mag-cause ng suprapubic tenderness. So, WBC on-site releases enzymes. Pathogens use enzymes to reduce nitrate to nitrite. So, parehas po yun, yung dalawa. Dun sa urinalysis po, magkakaroon po ng findings na increased colony count, increased WBC, bacterial culture positive. So, may makikita po natin yung presence ng bacteria sa urine. Then, positive nitrites, leukocytes, esterase, then foul, turbid urine, then hematuria, pwede rin pong present. Then yung kapag inflammation naman po is nag-occur sa renal parenchyma and capsule. Yun, pwede po siyang mag-cause ng flank pain. Ano to? Costovertebral angle tenderness. Then, dun naman po sa colonization and invasion of the bladder mediated by pill and adhesion. Bacterial colony irritates the urinary epithelium. So, kapag po nagkaroon tayo ng irritation sa urinary epithelium, pwedeng mag-cause ng dysuria or yung painful urination nga po. So, aside po doon, sa painful, pwede rin discomfort tuwing magbo-void po. Then, pwede rin mag-cause ng stimulation of urinary reflex. So, meron pong urgency and frequency. So, urgency, yun po yung sensation na kailangan po natin agad mag-urinate. Then, yung frequency naman, yun yung sensation ng repetitive need to urinate. Yun. So, sorry classmates, hindi ko ma-explain ng ayos yung iba kung paano, yung ibang symptoms kung paano lumabas. Kasi hindi ako mahanap ng discussion. So, sorry po. Yun lang po. Thank you.
Okay, thank you for that. Sige, before we move to board exam questions, thank you for that detailed check. Kung pinakinggan nyo lang siya. So the discussion went small lang, smooth, concise lang, pero detailed siya in all fairness naman. So kanina, na-note ko lang, isa sa mga binabanggit ni Ms. Regala is that fluoroquinolones is actually a drug option being used to UTI. Okay? So that is actually correct. However, compared to the other medications, fluoroquinolones, since it's a third generation antibiotics, it is not the first or primary antibiotics that is being used to UTI. Okay? So the primary pa rin, of course, sa UTI, dapat nga walang antibiotics as much as possible. Otherwise, there is a massive increase in your white blood cells. Okay? Why? Because fluoroquinolones has high prevalence or incident rates ng pagkakaroon ng adverse effect. And one of the adverse effect nito talaga is pagkakaroon ng tendonitis, okay, inflammation of your tendons, atralgia, ano pa ba? Nagkakaroon ng sleep disturbances, nagiging insomic ang pasyente, okay? So, masyadong mataas yung rate na kapag nag-intake ka ng fluoroquinolones, ay nagkakaroon ka ng mga ganong adverse effects. That's the reason why it is not a primary use. Otherwise, kapag masyado na talagang mataas yung WBC. Okay? So, let's proceed with your board exam questions. Ms. Regala, please. Okay, so the question, on your nursing care plan for a patient with urinary tract infection, which of the following would be appropriate nursing interventions? Again, on your nursing care plan for a patient with a urinary tract infection, which of the following would be appropriate nursing interventions? Select all that apply. So A, encourage voiding every 2 to 3 hours while awake. B. Restrict fluid intake to 1 to 2 liters per day. C. Monitor intake and output daily. D. The patient verbalizes the importance of using vaginal sprays to decrease recurrence of urinary tract infections prior to discharge home. So, you need to select all that apply. Anong choices ninyo? 10
So,
seconds.
ayun po. Nasagot ko sila.
Mhm.
Kung ako po, AC po.
Mhm. Okay. YAC. Regala.
Yun. So, classmates, sasagutin ko based lang sa knowledge ko. So, yung first, encourage voiding every 2 to 3 hours while awake. Kasi nga, di ba, tawag dito, yung may kasi nabanggit ko kanina dun sa risk factors, kapag meron tayong urinary, ano yun? Ano ba yung term na ginamit? Wait lang, wait lang. Nasaan na yung term? Yan, kapag meron tayong urinary tract abnormalities or blockages dun sa urinary tract. So meaning nun, yung urine natin hindi nakakalabas. So kapag nag-accumulate yung urine sa bladder natin, mas may tendency na mag-accumulate din yung bacteria doon sa may bladder. So edi mas magmumultiply yon. Then yung letter B kasi, kung restrict fluid intake 1 to 2 liters per hour, di ba most commonly kapag wala namang ibang condition or comorbidity yung patient, ang nire-required lagi ng doktor, uminom lagi ng maraming tubig. 8 glasses a day, gano'n. Pero usually, depende rin kasi sa individual, dapat 1 to 2 liters per day yon. Pero kung katulad nga nito na may urinary tract infection, tingin ko kailangan hindi ilimit yung fluid intake kasi kailangan yun para mag-void din yung pasyente. Para nai-eliminate yung mga urine kasi may kasama ding bacteria yun eh. Then next naman, yung letter C, monitor intake and output daily. So yun, kasi nga 'di ba pag hindi natin nailabas yon, pwedeng mag-cause siya ng septic shock. or bacteremia. Then, yung letter D naman, the patient verbalizes the importance of using vaginal sprays to decrease reoccurrence of urinary tract infections prior to discharge home. Kasi hindi naman sinasuggest talaga ng mga doctors na gumamit tayo ng mga feminine wash. Kasi 'di ba sabi nila, paniniwala ko lang ha, kasi sabi nila yung vagina daw self-cleaning naman yun tsaka daw talaga yun, low maintenance. Kaya para sa'kin ang tingin ko sagot A and C po.
Okay, so that's correct. The correct answer is A and C. So let's have a better discussion to that as to why. First, let's encourage voiding every 2 to 3 hours while awake. The reason is you have already UTI, you have already infection, okay? um, and you want to avoid a further infection to happen caused by UTI. So, para siyang water, okay, kapag yung water hindi siya pinapalitan, the water would be a medium for your bacteria to multiply or to grow. So, the reason why kailangan yung umihi every 2 to 3 hours, it is for the water not to retain doon sa inyong bladder. Okay? So, mapapalitan nyo ng panibagong water accumulation from your body and that you will be voiding it out again so hindi siya magkakaroon ng retention. Because the more water retention you would have in your bladder, the more medium you would give for your bacteria to multiply. So the correct answer is A. Letter C, monitor intake and output daily. Yung reason bakit natin minomonitor yung intake and output daily, it is because we would like to know, okay, whether the UTI is really greatly affecting your urinary tract, okay? Kapag balanse or patas ang inyong intake and output daily, then that would suggest that what you input or what you intake is coming out as your urine. So that would tell that you have a patent, okay? Patent, effective, and efficient urinary tract. But if you have UTI and then you intake much water, okay, and then you do not urinate same amount of water you have intake, then that may, okay, suggest that the inflammation is too massive that the urine cannot pass through. So, may makikita ka rin na minsan magre-report sila na they have a costovertebral pain. It is because the water is accumulating in your bladder and it's not being released. Kapag nag-accumulate too much doon, parang feeling mo sobrang full, but even how much you urge to pee, you cannot. Okay? So that's the reason why you monitor the intake and output for you to be able to assess whether your urinary tract is patent or not. Okay? Though also, the primary assessment for you to know whether your urinary tract is patent or not is of course the passage of the urine. Okay? When there is passage of urine, then it's patent. However, if there is a passage of urine, but the urine passage is not equivalent to the input that you have made, then it can tell you lang that inflammation is worsened. Okay? Kasi, oo, totoo, nakakaihi ka, but you are not capable to urinate or produce urine same amount of what you have intake. Okay? So, that's the reason why you need to do the ANC. Yun yung reason behind. Now, bakit hindi restrict fluid intake 1 to 2 liters per day? Okay, the correct answer, baka malito kayo. The correct answer is A and C. The wrong answer is B and D. Bakit restrict fluid intake 1 to 2 liters per day? Bakit mali? Mali siya because we all know for a fact na your bacteria is invading your urinary tract. Tama? And the only means for you to expel out the bacteria is, of course, through your antibiotics injected to your blood vessels or through your oral antibiotics. But of course, urine, continuous flushing of your bladder through intake of fluids, okay, and ihe, that would be beneficial para ma-flush out yung bacteria. Because one example, for example, yung pag na-dislodge ang E. coli ninyo, E. coli is normally present to your gut. Pero kapag na-dislodge yun, papunta sa inyong bladder, okay, that would cause urinary tract infection. And there's no way for E. coli to climb back to your gut. 'Di ba? Kasi wala naman tayong process na ginagawa na magmula sa paakyat sa bibig. But pambibig, pababa sa puwet o pababa sa ihi, meron. So the only way for us to expel out the E. coli that is wrongly placed in your bladder or in your urinary tract is of course through intake of water and expelling it through your urine. Kaya dapat you need to increase oral fluid intake. You need to increase oral fluid intake also, not just simply to flush out, but also to create pressure, okay? To create pressure in your urinary tract, okay? Na magpupush, magbe-bear down ng fluid nyo out of your urinary tract. Kasi if your urinary tract is inflamed, okay? Kailangan siya magkaroon ng pressure para hindi magsara ang inyong tract, okay? So that's the reason why you need to increase fluid intake instead of limiting the fluid intake. Letter D, bakit wrong ang letter D? Letter D is wrong, okay? The moment you've heard cleaning of your vagina, it's wrong choice already. Why? Nabanggit ni Regala kanina, it is self-cleansing, okay? Not basically self-cleansing, kasi alam natin pag hindi natin yan nahugasan, may amoy yan. I know for a fact, been there, okay? So, hindi siya ganun ka-self-cleansing. However, we need to maintain the normal flora in our vagina. In our vagina, as if meron ako. You need to maintain the normal flora of your vagina. Okay? Why? Your vagina is normally acidic. Okay? So, acidic in nature ang vagina. Okay? That's the reason why kapag tumagal na parang hindi mo siya pinupunasan, parang medyo maasim. Okay? Because it's normally acidic. Because that's a wonder of nature. Why? Because the semen, okay, the semen of male, these are basic naman. So for the semen to have a better chance of survival sa vaginal canal, acidic ang vaginal. Okay? Now, if you would try to put some sort of any detergent, soap, or whatever cleansing sa inyong vagina, that would alter the pH level of your vagina. Okay? And when the pH level of your vagina alters, okay, that would give a better chance for opportunistic bacteria na doon ay mag-migrate at mag-multiply. So that's the reason why it's a wrong choice. The correct answer, it's A and C. Okay? Next question. Next question. A 36-year-old female who is 29 weeks pregnant reports she is experiencing burning when voiding. The physician orders urinalysis, which statement by the patient demonstrates she understands how to collect the specimen. Ulit, the question is, a 36-year-old female who is 29 weeks pregnant reports she is experiencing burning when voiding. The physician orders a urinalysis, which statement by the patient demonstrates she understands how to collect the specimen. A. I'll hold the cup firmly against the urethra while collecting the sample. B. I will cleanse back to front with the antiseptic wipe before peeing in a cup. C. First, I will pee a small amount of urine in the toilet and then collect the rest in the cup. D. I will be sure to drink a lot of fluids to keep the urine diluted before peeing into the cup. What's your answer? Okay, so many of you answer C. Let's have Cervera. Why letter C? Cervera. Why letter C? Woo!
Sorry po, mali na pindot.
Ah,
Kasi sir, yung turo kasi dun sa ospital po umihi daw po muna para daw po ano ba yun? Basta po pinapaihi po muna bago maglagay doon sa ano, sa doon po sa maliit na cup. Basta
Okay.
parang ganun po.
So the answer is correct. The correct answer is first, I will pee a small amount of urine in the toilet and then collect the rest in the cup. So the reason behind it is why. We all know for a fact na yung inyong bladder, okay, isa siyang lagayan ng ihi. Okay? And by the gravity, by the pull of gravity, okay, unang babagsak doon yung nasa pinakailalim ng bladder. Tama ako? Okay. So kung unang babagsak yung nandoon sa pinakababa ng bladder, unang lalabas yun sa ihi ninyo, and the bacteria and other fragmented materials are all what? Mabigat. Okay? So when that is mabigat, lulubog siya doon sa base ng inyong bladder. And if that's the case, if that's the first material to be eliminated, and those are the materials that will be catched along with the urine. So that will give you uh, a false, um, a false positive na bacteria sa urine. Okay? So that's the reason why the first thing you need to do is to flush out yung first urine niyo and you catch the midstream urine. Pag nabasa nyo, collection of urine, laging midstream urine. Pag sinabing midstream urine, yun yung kalagitnaan ng ihi. So, ibig sabihin, ihi muna, yung gitnang iihi, salo, and then tapusin ang pag-ihi. Midstream. Ibig sabihin, gitna. Okay? So, in that note, makikita mo lang na dapat na-eliminate na yung mga particles or yung mga residue na nagsettle sa bottom ng yung bladder. And that would be the first materials kasama ng yung urine na may expel out. So yung clean catch o yung midstream urine, okay? So mas makikita natin yung percentage na totoong may bacteria kung meron man, kung wala, mas makikita natin yung kanyang percentage. Kasi kung hindi lang sa bottom marami yung bacteria, then normally present siya sa buong system ng bladder. So present siya sa buong urine na na-contain doon sa bladder. Pero kung present lang siya doon sa bottom at nag-false positive tayo doon kasi yun lang na-catch natin, then that would give us a wrong diagnosis which would lead to wrong intervention. Same with your CBG, capillary blood glucose monitoring. Di ba? Kapag nag-check tayo ng CBG, meron na ba sa inyo nakapag-check ng CBG? I hope and I pray meron na. So, di ba, tulad nung sa CBG, okay, ang una natin ginagawa is wipe ng alcohol pag napili na natin yung finger, okay, and then prick. After you prick, unang labas ng dugo, you will not collect it, okay? You need to wipe, okay? Pagka-wipe, the following patak ng dugo, that's the dugo that you will be using for your CBG. Why? Because the first blood na lalabas doon, because it's located in your periphery and the gravity has much power in your periphery, okay? Andoon yung concentration ng blood, okay? So kapag yun ang kinuha yung basahin, that will give you a false high reading ng capillary blood glucose ninyo. Okay? So kaya hindi natin siya kinukuhanan. So same with your urine. So same principle applies. Okay? Understood? Next question. You are providing discharge teaching to a female patient on how to prevent urinary tract infections. Which statement is incorrect? You are providing discharge teaching to a female patient on how to prevent urinary tract infections. Which statement is correct? Is incorrect? A. Void immediately after sexual intercourse. B. Avoid wearing tight-fitting underwear. C. Try to void every 2 to 3 hours. D. Use scented sanitary napkins or tampons during menstruation. Correct answer, please. Okay, and the correct answer is D. Okay? Use scented sanitary napkins or tampons during menstruation. Why? Because sinabi na nga natin, your vagina, your reproductive part, girls, are with a specific pH level. Okay? So it is normally regulated, naturally regulated. Okay? So meaning, there's no other forces or external factors that might or must affect its normal or natural way of balancing the pH. So, knowing for a fact, lalo pa pag gumamit ka ng napkins na scented, then that would alter your pH level. That's the reason why it's incorrect. It's a no, no, no. Okay? Void immediately after sexual intercourse. Why do you need to void? Okay? Sure, iba naman ang pinapasukan okay, para sa nasa medical field naman tayo, iba naman sir ang pinapasukang entry ng penis kumpara doon sa nilalabas ng ihi ng babae. Yes, it's a different passage, okay? Vaginal canal and that of the urethral meatus, okay? Magkaiba sila. However, there's a friction, di ba, that is happening, okay? So, when there's a friction, okay, that may dislodge certain microflora that is should be only present in a vagina that can pass through your urethral meatus and then later on may lead to UTI. That's the reason why you need to void out. Para kapag nag-void out ka, kung ano man yung na-dislodge na na-dislodge na bacteria that pass through your urethral meatus, since dadaan ng ihi sa urethral meatus, may chance na ma-eliminate niya yun through ihi. Okay? So that's the reason why you need to void after sexual intercourse. Okay? Syempre, there are some other exhibitions then that you do. Okay? I'm not telling lahat ginagawa yan na. But there are some other exhibitions that you do, like the use of your finger, the use of other dildo or whatsoever, okay? Same principle would apply, okay? So when you do when you use those things and you satisfy yourself already, you need to void out as much as possible. That is to avoid UTI, okay? That's the reason why there are people na pag sinabi nila they are sexually active or they are sexually addict, pero they don't have partners, for example, or because they use some other forms of satisfying themselves. Madalas, parang masakit yung kanilang sikmura o may masakit sa kanilang vaginal or sa kanilang puerta. It is because they are undiagnosed with UTI. Okay? Because it's milder, okay, but still UTI, which can migrate and can be complicated. Okay? So this is the reason every after any insertion in your I'm not saying you do it I mean when you teach your patients, okay, they need to void. Okay? Avoid wearing tight-fitting underwear. Of course, you need to avoid tight-fitting underwear. The reason why is, of course, a friction. Kapag masyadong tight yon, okay, hindi masyadong makaka-breathe. Pag hindi masyadong nakaka-breathe, magbabago ang pH. Other reason is because of its tightness, it will cause to friction. And when friction happens, magkakaroon ng dislodge ng normal microflora that may invade your urethral meatus. So that's the reason why you need to avoid wearing tight-fitting underwear. Pero we are not telling that you wear a loose underwear, yung abot hanggang tuhod. Hindi naman. But we are just what we just suggest is avoid using, if you are 20 years old, 20-year-old girl, avoid using underwear that is good for 1-year-old. Okay? Yun lang naman yon. Okay? Try to void every 2 to 3 hours. That's correct. Okay? Nabanggit na natin kanina yung rationale why do we need to do every 2 to 3 hours. Okay? Next. Okay, so that's the last board exam question. Thank you. BPH.
Wala po ata si Mixer. Wala daw po siyang internet po.
Oh, wala si Mig, so wala siyang internet.
Opo.
Okay, wait lang ha. Okay, so please advise Mig na lang na ganito. I have given the same amount of tolerance din naman kay Miss Nicole. Tama ba? Please advise Migs to record the reporting niya and then send it to the group. Sa chat group natin. Okay? So, who's next after Migs?
Ako po.
Jam. Sige, Jam, ikaw muna.
So, start tayo. Good afternoon po. Yung report ko po is lower urinary tract infection or cystitis or the inflammation of the bladder po. Next po. Definition: urinary tract infections are caused by pathogenic microorganisms in the urinary tract. Lower urinary tract infections include bacterial cystitis or the inflammation of the urinary bladder, bacterial prostatitis or the inflammation of the prostate gland, and the bacterial urethritis, inflammation of the urethra. Etiology, origin, lower gastrointestinal or the GI tract. Causative agent is E. coli po. Risk factors, predisposing, gender, mas common po siya sa female, then family history, age, NDM. Kapag may diabetes ka, yung mga patient na nagsasuffer from diabetes, mas higher yung sugar level nila sa urine. So, nagpo-provide po to ng good environment sa bacteria para mas mag-grow. So, kaya naglilit po to sa UTI like cystitis po. Sa precipitating factors po, catheterization, kapag long-term na po yung paggamit ng catheter, cystoscopic procedure, perpetuating decreased natural health defenses or immunosuppression and sexual intercourse. Kapag hindi tama yung kakaroon ng sexual intercourse, nagkakaroon din ng sexually transmitted disease, tapos yung improper hygiene in genital area. Signs and symptoms, yung pain caused by distension of some portion of the urinary tract result of the obstructed urine flow or inflammation. Yung frequency, yung frequent voiding niya, more than 3 hours. Tapos yung urgency, yung strong desire to void, then yung hematuria, yung RBC in the blood. Sa urine pala. Sa diagnostics po, yung urine culture, ito nga po yung test to check for the germs or bacteria in your pee that can cause UTI po. Collects through pee in a cup po, yung parang sinabi din po kanina. Tapos yung circular studies, nabanggit na din naman po kanina, yung multiple test, dipstick, yung leukocyte esterase test, pati yung nitrate test. Yung leukocyte esterase test is a urine test to look for WBC or other signs of infections. Yung nitrate test, yung positive nitrate test indicates that the cause of UTI is a gram-positive organism or the E. coli po. Tapos, yung transrectal ultrasonography, way of creating an image of the prostate gland using sound waves. Next po. Sige, ayos lang. Sige, okay lang, medical management na. Medical management? Sige, okay na yun.
Wait lang, wait lang.
Sige lang, sige lang. Ayan, medical management. Kapag complicated UTI naman po, nire-reseta lang po ng antibacterial agent or ampicillin, single dose administration, short course 3 to 4 days regimens or 7 to 10 days regimen. Kapag complicated UTI, hospitalization and intravenous or IV antibiotics po. Nursing diagnosis, acute pain related to infection within the urinary tract, deficit knowledge, then yung planning and goals. Major goals for the patient may include relief of pain and discomfort, increased knowledge of preventive measures and treatment, modalities, and absence of complications. Nursing management, assessment, signs and symptoms, pattern of voiding, frequency of emptying the bladder, the association of symptoms of UTI with sexual intercourse, contraceptive practices, and personal hygiene are assessed. The patient's knowledge about prescribed antimicrobial medications and preventive health measures is also assessed. The urine is assessed for volume, color, concentration, cloudiness, and odor, all of which are altered by bacteria in urinary tract. Nursing intervention. Number one is relieving pain. Antispasmodic agents may also be useful in relieving bladder irritability and pain. Analgesic agents and the application of heat to the perineum help relieve pain and spasm. The patient is encouraged to drink liberal amounts of fluids to promote renal blood flow and to flush the bacteria from the urinary tract. Urinary tract irritants are avoided. Frequent voiding is encouraged to empty the bladder completely because this can lower urine bacterial counts, reduce urinary stasis, and prevent reinfection. Monitoring and managing potential complications. The patient must be taught to recognize signs and symptoms to test to bacteriuria and initiate treatment as prescribed. Appropriate antimicrobial therapy, liberal fluid intake, frequent voiding, and hygienic measures are commonly prescribed for management of UTIs. The patient is instructed to notify the physician if fatigue, nausea, vomiting, and pruritus occurs. Periodic monitoring of renal function and evaluation for structures, obstructions, or stones may be indicated in for patients with recurrent UTIs. Number three, promoting home and community-based care. Teaching patients self-care, including practicing careful personal hygiene, increasing fluid intake to promote voiding and dilution of urine, urinating regularly and more frequently, and adhering to the therapeutic regimen. Patient teaching to prevent recurrent urinary tracing agents and the application of heat to the perineum help relieve pain and spasm. The patient is encouraged to drink liberal amounts of fluid to promote renal blood flow and to flush the bacteria from the urinary tract. Urinary tract irritants are avoided. Frequent voiding is encouraged to empty the bladder completely because this can lower urine bacterial counts, reduce urinary stasis, and prevent reinfection. Next is patient teaching. Hygiene. Shower rather than bath in tub because bacteria in the bath water may enter the urethra. After each bowel movement, clean the perineum and urethral meatus from front to back. This will help reduce concentrations of pathogens at urethral opening and in women, the vaginal opening. Fluid intake. Drink liberal amounts of fluid daily to flush out bacteria. Avoid coffee, tea, colas, alcohol, and other fluids that are urinary tract irritants. Voiding habits. Void every 2 to 3 hours during the day and completely empty the bladder. This prevents over distension of the bladder and compromise blood supply to the bladder wall. Therapy. Take medication exactly as prescribed. Special timing of administration may be required. If bacteria continue to appear in the urine, long-term antimicrobial therapy may be required to prevent colonization of the periurethral area and recurrence of infection. Notify the primary healthcare provider if fever occurs or if signs and symptoms persist. And di ko mabasa din, care provider regularly for follow-up. Ayan, consult the primary healthcare provider regularly for follow-up. Evaluation. Number 1, experiences relief of pain. Reports absence of pain, urgency, frequency, nocturia, or hesitancy on voiding. Takes analgesic, antispasmodic, and antibiotic agents as prescribed. 2. Explain UTIs and their treatment. Demonstrate knowledge of preventive measures and prescribed treatments. Drinks 8 to 10 glasses of fluids daily. Voids every 2 to 3 hours. Produces urine that is clear and odorless. Number 3, experiences no complication, reports no symptoms of infection or the fever or infrequency, has normal renal function, negative urine and blood cultures. Exhibits normal vital signs and temperature, no signs and symptoms of sepsis, and maintains adequate urine output, more than 30 ml per hour. So, doon naman tayo sa pathophysiology of cystitis. Once na ma-invade ng E. coli yung urethral mucosa cells, which is yung portal of entry, mas mabilis na mai-invade ng E. coli yung uroepithelium kasi may adhesin and fibril structures na magbabind sa host cells receptor sa epithelium. Then kapag na-sense na may invasion, ang mag-a-act or magre-release ng inflammatory mediators, yung cytokines or chemokines, yung cytokines na interleukin 6 and interleukin 8. Kaya magkakaroon ng neutrophil recruitment. Since mayroon nga pong stimulation ng cytokines, magkakaroon siya ng changes on the surface of the endothelium. Kaya maglilid po yun sa tissue damage in urinary tract po. Tapos po, sa urethra po, magkakaroon po ng uretrovesical reflux, a backward flow of urine from urethra into the bladder po. With coughing and sneezing po, yung bladder pressure is magi-increase po. So, magkakaroon po ng force sa urine from the bladder into urethra po. Tapos po, kapag yung pressure po is naging normal na, yung urine na babalik po sa bladder is contaminated na. Magkakaroon po or maglilid po yun sa urinary, since contaminated na po, magkakaroon din po yun ng urinary stasis, kaya nade-develop po yung prostatitis po. Tapos po, ganun din po sa ureter, meron din pong reflux na kasama yung ureterovesical reflux po. Kapag may failure ng ureterovesical valve po, yung urine is tataas po or magmo-move sa ureter during voiding po. And yung flow sa bladder, magi-stop when voiding po, magi-stop po siya. So mangyayari po nito, pine-prevent nito yung emptying ng bladder. So maglilit din po yun sa contamination and urinary stasis. Yung mga reflux na po yun, nagkakos po yun ng contamination sa bladder, which is alam naman natin na sterile ang urine kapag nasa bladder pa. So yung mga reflux po, makontaminate nga po yung urine na maglilid po sa inflamed bladder. Kapag po na-damage po yung bladder lining, magkakaroon po ng RBC in the urine or tinatawag po na hematuria. Tapos po kapag low estrogen or acidic yung urine, contributing factors lang siya para ma-damage yung lining ng bladder. Pero yung etiology nga po niya is E. coli. Once na na-damage po yung bladder lining, magkakaroon po ng leakage ng urine sa bladder, muscle. Tapos po, yung trigon po, triangular portion po siya ng bladder. Meron po siyang muscles na naglalabas ng histamine na nagkakos po sa bladder na mag-swell or yun nga po, swelling. Tapos po, yung mga nerves, yung sensory nerves po outside the bladder, magsisend po siya ng signal kay brain. Kaya po, nagkakaroon po ng pain. Tapos po, si brain, magsisend, pag puno na po yung bladder, mag-aano po siya magsisend siya ng motor signal po, pababa. Kaya nagkakaroon po ng bladder spasm or contraction. Kaya po yung naglilid po yun sa frequency or urgency to void po. Yun po.
Okay, so thank you for yun na yun, Be. So thank you for the discussion. So malinaw din naman yung discussion ni Jamil. Hope you have listened. Okay? So ulitin ko lang, highlight lang natin. Isa sa binabanggit niya kanina is that the urine is sterile, okay? Habang nasa bladder ninyo, okay? So all the fluids, okay, inside your body is almost sterile to consider. It's not basically talaga sterile, okay? Because for a certain something to be sterile, okay, dapat hindi siya na-touch ng kahit anong foreign particles or material. We can only consider sterile ang urine inside the bladder doon sa mga newborn. Okay? Kasi yung kanilang gut and everything is sterile kasi kakalabas na nila from the womb ng kanilang mother. But tayo mga adults, okay, from after nung first ihi ni baby hanggang sa tayo tumanda na, it's no longer sterile. Okay? But it's somehow clean kasi it's something inside your body. Okay? Yung binabanggit nilang kanina din, once it's inside your urinary bladder, okay, ihi ninyo, it's malinis. However, okay, because of the infection niya, okay, it will constrict. Okay, kapag nag-constrict, we all know for a fact that the bladder is made up of muscle. Okay, that's the reason why it's capable of contracting, kaya kayo umiihi, and then it expands kapag napupuno ng ihi. Kaya lang, if a bacteria and the inflammation is present, then nagkakaroon ng regurgitation ng fluids. Okay? It's not simply retention, but also regurgitation. So parang umiikot. So yung fluid na nandun sa pinaka-base ng inyong urinary bladder, pwede siyang mag-switch doon sa pinaka-top layer na fluids. Kasi nga, nagkakaroon ng contraction. Okay? And with that effect, lalo niyang napapakalat yung bacteria inside the bladder and i-invade yung buong cell walls ng inyong bladder, which causes a complicated cystitis. Okay? Questions? Okay. So the question is, the female client in an outpatient clinic is being sent home with diagnosis of urinary tract infection. Which instruction should the nurse teach to prevent a recurrence of a UTI? The question, the female client in an outpatient clinic is being sent home with a diagnosis of urinary tract infection. Which instruction should the nurse teach to prevent a recurrence of a UTI? A. Clean the perineum from back to front after a bowel movement. B. Take warm tub baths instead of hot towels daily. Hot showers daily. Void immediately preceding sexual intercourse. D. Avoid coffee, tea, colas, and alcoholic beverages. What's the correct answer? C, D. The correct answer is D. Tama ba? Avoid
Opo.
coffee, tea, colas, and alcoholic beverages. Okay? Why? Clean the perineum from back to front after a bowel movement. Okay? This is correct. Okay? This is correct. Pero kung makikita nyo, ang kanyang modifiable factor na mali dito is that from back to front. Di ba dapat ang punas ninyo, mga girls, is from front to back. Kasi from back to front, yung perineum ninyo, okay, nagsiseparate ng inyong vagina and that of your anus is napaka-thin lang. Okay? So there are chances na yung bacteria from your anus is nasa perineum area ninyo. So kung from back to front, ini-spread nyo sa inyong labia ang dumi ng inyong puwet. Okay? So that's wrong. But it's correct that every after you need to clean your perineum, but front to back. Okay? Take warm tub baths instead of hot showers daily. Warm tub baths, what would happen with warm tub baths? It's okay to do the warm tub baths, but not daily. Okay? Why? Because if daily, you will soak your vagina sa bathtub. Okay? At kapag na-soak yan, matagal, everyday na-soak, usually kapag nagbabathtub pa tayo, naka-warm nga, medyo hot, medyo siya, hindi siya malamig, medyo maligam-gam na mainit. Ganun ang temperature ng tubig ng warm tub baths. Okay? So can you imagine, kung yung kapal nga ng kalyo ninyo sa kamay, kapag matagal nakababad o nakababad na matindi sa tubig, ay kumukulubot, what more of your vagina? Try to check. Okay? So, mangungulubot. So, kapag nangungulubot, ibig sabihin, natutuyuan. And your vagina has to be kept, what? It has to be kept moist. Okay? Moistened, hindi ko sinabing basa. Magkaiba yung moist sa basa. Sabi ni Sir, dapat daw it should be kept moist. Dapat laging basain. No, it's moist lang, hindi basa. Okay? So, kapag after hot tubs, makikita nyo, madadry siya. So, pag madadry, nababago ulit ang pH. Kapag nabago ang pH, okay, that would cause, of course, another dislodgement of the bacteria, which would lead to UTI. And another thing is, syempre, pag naka-bathtub ka, pag naka-bathtub, nakalusong ka, okay, yung water pwedeng continuous lang nagpa-pass through and out, di ba? Hindi ko sasabing pasok na pasok sa vagina, pero habang nag-move yung kamay mo or yung paa mo, nagkakaroon ng current ang water. So pag nagkakaroon ng current ang water, nagkakaroon ng movement. And that movement may lead also to dislodgement of bacteria to your urethral hiatus. Ang hirap maging babae, no? Kasi sa lalaki, kahit isaw-saw mo pa yan dyan, walang problema. Okay? C. Void immediately preceding sexual intercourse. Sir, sabi mo kanina, tama naman ito. What makes it wrong is that void immediately preceding sexual intercourse, yung preceding. Okay? Sir, ang binabanggit nito, after sexual intercourse. Well, that's correct. Pero yung sinasabi naman natin na preceding, since pag nakabasa kayo ng questions na ano bang binabanggit itong precede? Na precede yung sexual intercourse o na precede yung void bago mag-sexual intercourse? Because if you would be trying to see this, you may take note na after sexual intercourse na yung binabanggit niya. Per precede ang ginamit niyang term. So ang binabanggit niya dito, mag-void ka muna bago mag-sexual intercourse, which is wrong. You will void after sexual intercourse. But then of course, correct din naman na mag-void ka muna bago mag-sexual intercourse. Kasi paano naman kung punong-puno ang bladder mo, tapos makipagbaknutan ka, 'di ba? So that's sorry for that term. I mean, you do it, 'di ba? So baka naman masundot ang iyong bladder, 'di ba? At mag-shower ka. But then for the UTI na usapin, of course, ang void ay gagawin after sexual intercourse. Okay? Next question. Correct ba tayo pala dun sa D?
Opo, sir.
Okay, so you need to avoid those colas. Because remember, okay, if you have UTI, okay, you need to have a normal pH lang na balancing sa iyong katawan. And colas, and some other tea-colored drinks, they are basically not pH neutral. If they are pH neutral, when they get inside of your body, they no longer pH neutral. So, kaya natin sila ina-avoid. Okay? Next, the nurse determines that instructions regarding prevention of future UTIs for a patient with cystitis has been effective when the patient states, the nurse determines that instructions regarding prevention of future UTIs for a patient with cystitis has been effective when the patient states, I will empty my bladder every 3 to 4 hours during the day. B, I can use vaginal sprays to reduce bacteria. C, I will wash with soap and water before sexual intercourse. D, I will drink a quart of water or other fluids every day. What's the correct answer? Okay, so the correct answer is, so sagasaan na natin yung mga kanina pa. Yung B na pag-usapan na natin yan, bawal talaga yung mga spray-spray. It will not reduce the bacteria, but it will alter the pH. So that's wrong. I will wash with soap and water before sexual intercourse. Parang hindi. And otherwise, ang gamitin mo, Ariel or Tide. Sinabi na natin, you don't need to make any preparations before you do sexual intercourse, okay? You may void if you feel you have to, okay? You may clean it with water if you feel like it's not uh, good, okay? But never use a soap to clean it, okay? Drink a quart of water or other fluids every day. That's correct, okay? That's correct. I will drink a quart of water or other fluids every day. That's correct. However, we are to address cystitis. Okay? So, cystitis yung target natin i-address dito, di ba? So, kung cystitis ang kailangan natin i-address dito, drinking of water would be beneficial, but other fluids is not. Okay? So, the correct answer is A. Tama ba? A ang tamang sagot dyan.
Yes po.
Okay. So that's the correct answer. You need to empty your bladder. Why? You need to empty your bladder because you know for a fact that you have already inflammation. Okay? So kung UTI nga na urinary tract infections na ang meron, ini-empty na natin yung bladder even though hindi pa bladder talagang affected. Okay? The more kapag cystitis na, kapag bladder na talaga yung affectation. Okay? May question pa dyan? Next. When assessing the patient who has a lower urinary tract infection, lower, the nurse will initially ask about when assessing the patient who has a lower urinary tract infection, the nurse will initially ask about A. Flank pain, B. Pain with urination, C. Poor urine output, D. Nausea. What's the correct answer? And the correct answer is B. Pain with urination. Okay? I think, okay? Pain with urination. Because, sabi, binanggit dyan, lower urinary tract infection. You would have a flank pain if you have a problem with your kidney. Okay? So that's not lower. That's upper portion of your urinary tract system. Okay? You will have poor urine output, okay, if you have problem with your kidney. So that's not lower urinary tract. Okay? Nausea, lower ang binabanggit natin. Okay? So, if lower part is the problem, nausea is coming out from your mouth. So, chances are the affected portion of the urinary tract system is are organs that are almost adjacent or near your gut. Kasi doon pwedeng magkaroon ng innervation ng nausea. 'Di ba? Otherwise, the UTI of the urinary tract infection or specifically sa lower urinary tract infection is massive that can cause for innervation of nausea, sending message to your brain. But this time, wala namang ganong disclosure. Ang sinabi lang, lower urinary tract infection. So kapag lower, okay, ang urination, mostly it happens sa pinakababang portion kasi doon lumalabas ang ihi. So, kung alin na may sagot na urination, may kasamang pain, of course, because there's an infection, then that's a correct answer. It's letter B. Tama ba? B ang sagot?
Yes po.
Tama na B ang sagot. Ay, medyo alanganin kasi ako dun sa nausea. Pwede kasi ang nausea if there's a massive UTI. But wala namang disclosure that there's a massive UTI. So the correct answer is pain with urination. Okay? Next reporter. May kasunod pa ba to? 3 lang kasing questions nyo eh. Oh,
Si Alex na po.
okay.
Hello po,
Alex.
rinig po. Rinig po ako.
Yes,
Yes
loud
po.
and clear.
Okay po. So, I'm going to discuss po diabetic ketoacidosis or DKA. So, what is DKA? Next po. So, sabi po, diabetic ketoacidosis or DKA is a life-threatening problem that affects people with diabetes. It occurs when the body starts breaking down fat at a rate that is much too fast. The liver processes the fat into fuel called ketones, which causes the blood to become acidic. So, discuss ko lang po paano na-develop si DKA. So, this condition develops kapag yung body hindi nakakapag-produce ng enough insulin. So, ano nga bang role ng insulin? Insulin normally plays a key role in helping sugar or yung glucose to enter the cells. Yung glucose, yun yung major source ng energy for the muscles and tissues sa body. So, syempre, sa mga diabetic patients, without enough insulin, yung katawan nila begins to break down fat as fuel. Yung process na yun, nagpo-produce ng build-up of acids sa bloodstream na tinatawag na ketones that makes the blood acidic. Then if left untreated, that will lead to our topic today, which is yung DKA or diabetic ketoacidosis. In addition, yung DKA pwedeng makuha ng kahit sino na may diabetes. Though sabi, rare daw po yung DKA sa patient with type 2 diabetes. Less common siya dahil yung insulin levels ng type 2 diabetes don't usually drop so low, then pwede pa rin mag-occur. On the other hand po, yung DKA pwedeng maging first sign ng type 1 diabetes kasi yung mga patient with this condition, hindi capable yung katawan nila to produce their own insulin. So next po. So for etiology, origin, DKA was first described in 1886 and until the introduction of insulin therapy in the 1920s, it was almost universally fatal. So for causative agent, the most common scenarios for diabetic ketoacidosis are underlying or concomitant infection such as pneumonia, sepsis, or UTI. Then next, missed or disrupted insulin treatment caused by non-adherence to insulin treatment plans, body image issues, then pwede din pumasok yung financial problems and psychological factors sa patient. Then another causative agent is yung newly diagnosed, previously unknown diabetes. Then yung other associated causes, pwedeng drug-induced such as yung antipsychotic agents, corticosteroids, glucagon, interferon, pentamidine, thiazide, diuretics, then syempre yung mga illegal drugs such as cocaine, then as alcohol as well. Then other associated causes then yung psychologic stressors such as myocardial infarction, Cushing disease, cerebrovascular accident or stroke, pancreatitis, pregnancy, shock, hypovolemia, and etc. etc. So for risk factors po, predisposing comorbidities type 1 and type 2 diabetes. For precipitating factors, unhealthy lifestyle, pwede ring matrigger yung mga nabanggit ko po kanina na causative agents like infection, heart diseases, recent stroke, pregnancy, drugs, surgery, and other trauma po. Then for perpetuating, frequently missed insulin doses. So yan yung poor integration ng treatment. Yung tulad ng di pag-take ng prescribed insulin, then negative health habits like skipping meals po. Next po. For signs and symptoms naman po, polyuria or yung frequent urination, polydipsia, yung excessive thirst, weight loss, then patient may be hypotensive and tachycardic due to dehydration and acidosis nga. Tapos patient may breathe rapidly and deeply to compensate for acidemia, which is yung osmolar breathing. Patient may exhibit nausea and vomiting. Altered consciousness or confusion may be evident. Tapos, in some cases sa patient, may exhibit acute cerebral edema. Pero it occur primarily lang daw po sa children and less often sa adolescents and adults. Next, patient may also have fruity breath due to exhaled acetone. Patient may be febrile, pero sabi po yung fever, hindi siya sign ng DKA. Pero if present, it signifies infection po. Then for laboratory findings, results show high blood glucose levels, high levels of ketones in urine, and other symptoms appear constantly feeling tired, dry or flushed skin, abdominal pain, particularly sa children. Next po, diagnostics. So, diagnostics sa DKA, blood test, used daw po to diagnose sa DKA para ma-measure yung mga point of care such as blood sugar level or serum glucose level, serum ketone level, and blood acidity. Sabi po in patient suspected with having DKA, kailangan din itest yung serum electrolytes, blood urea, nitrogen, and creatinine, glucose, ketones, and osmolarity, kailangan rin pong i-measure. Yung urinalysis po confirms the presence of glucose and ketones and will help assess po for presence of urinary tract infection. Then patients who appear significantly ill and those with positive ketones should have ABG measurement or arterial blood gas test po. If patient shows signs and symptoms po of triggering illness, kailangan po i-pursue yung other tests such as cultures and imaging studies. Tulad nga po ng X-ray and EKG. Yung chest radiography po, perform if pneumonia or pulmonary disorder is suspected. Then yung ano naman po, electrocardiography, assess naman po effect of potassium status and rules out ischemia or myocardial infarction. So next po, medication. For medical treatment medications, rapid-acting insulin, short-acting insulin, electrolyte supplements, alkalizing agent. So, ito pong meds na to, magpo-fall siya sa treatment natin. Moving on sa treatment po next. So, yeah, masyadong mahaba yung treatment. So, to simplify that po, fluid replacement, get the patient hydrated to bring blood chemistry back to balance. Then for electrolyte replacement, through an IV to replace the key minerals like sodium, potassium, and chloride to keep the heart, muscle, and nerves working properly. Then for rapid-acting and short-acting insulin through an IV, to bring the patient's ketone down, pwede rin yung sub-Q, yung insulin therapy. Then, if patient have infection po, antibiotic is prescribed po. For nursing management po, next na po. Thank you po.
Wait lang. Wala, ayaw.
Okay pa. Thank you. So, nursing management assessment, signs and symptoms, physical examination, family history. So for diagnosis, fluid volume deficit related to electrolyte imbalances, impaired physical mobility related to pain and discomfort, and ineffective breathing pattern related to acidosis. For planning po, restoring circulatory volume, insulin therapy with fixed rate intravenous insulin infusion, correcting metabolic acidosis and electrolyte imbalances, stabilize weight or gain toward desired range with normal laboratory values. Then client will remain normobulimic as evidenced by urinary output greater than 30 ml per hour and blood glucose levels between 70 to 200 milligram per deciliter. So ano nga ba yung mga intervention? So for intervention, administer medication and fluid as appropriate. Explain the importance of dietary plan. So kailangan careful pa rin sa kinakain si patient. Elevated head of the bed, assist with ambulation, promote comfortable environment, assess patient ability to perform ADL, and monitor oxygen saturation levels and assess depth and rhythm of respiration every hour. Then maintain fluid intake of at least 2,500 ml per day within cardiac tolerance when all our intake is resumed. Then measure and correct urine output early. Report urine output less than 30 ml for 2 consecutive hours. So for evaluation, homeostasis was achieved, causative factors were controlled, performs physical activity independently, maintain fluid intake of at least 2,500 milligram per day, then urine output, then corrected metabolic acidosis and electrolyte imbalances. So, yan po, pathophysio ng DKA. So, simulan natin sa risk factors po. So, commonly associated nga po sa type 1 diabetes, then pwede rin siyang mag-occur sa type 2 diabetes. Usually triggered when diabetic patient undergo further stress, yung nabanggit nga po kanina, such infection, inadequate insulin administration, or cardiovascular diseases, which leads to low insulin level or absolute insulin deficit po. Di-discuss ko po muna what is glucose and insulin ulit. So insulin is hormone released by beta cells of the pancreas and is responsible for driving glucose into cells. So glucose, siya naman po yung major energy source ng body, comes from the digestion of carbohydrates and carries by the bloodstream sa various organs po. When deficient yung glucose, hindi po siya makakapasok sa cells and nag-i-stay lang siya sa blood. Simply, hindi siya nagagamit ng muscles and fat cells. Dahil nga nag-stay lang si glucose sa blood and not been utilized, si hypothalamic cells, na-sense niya na low yung intracellular glucose sa katawan, and it stimulates feelings of hunger or yung tinatawag natin polyphagia. Dahil nga need ng cells ng energy, si hypothalamic cells nag-send ng signal na magutom yung katawan, then kumain para makapag-convert siya ng energy. Isa pang nangyayari sa remain glucose sa blood, cells starve of glucose. In response to this metabolic starvation, the body increases the level of catabolic hormones. So, yan nga po yung mga hormones. Then, due to metabolic response, yung body tries to increase blood glucose to hopefully increase cell glucose absorption. Dahil nga sa metabolic starvation, the body produce more glucose in an attempt to supply energy sa cells. This is done by synthesizing non-carbohydrate substrates such as protein and lipids, which result in an increased gluconogenic substrate for liver. Liver metabolism po or metabolism ng fatty acids, alternative energy source po siya to produce ketone bodies. And breaking down glycogen into glucose by the mechanism of glycogenolysis. Dahil nga po increase yung glycogenolysis mechanism sa liver, so tuloy po yung production ng glucose sa blood. Which leads to hyperglycemia. Dahil nga hindi nagagamit ng cell si glucose, yung metabolic response, nag-result lang siya na mas maraming sugar sa blood. Then, as the blood level exceeds po the ability of the kidneys to reabsorb, it overflows sa urine, resulting in glucosuria. So, overflowing of glucose, taking water and electrolyte along with it, in a process known of osmotic diuresis, which results in large volume of urine or tinatawag nating pababa po, polyuria. Then, polyuria can cause dehydration that leads to increased extracellular volume, concentrates ketone bodies, and exacerbate acidosis, resulting in metabolic acidosis. So, balik tayo kay dehydration. Dehydration causes excessive thirst or polydipsia. Dahil nga dehydrated, also nagre-result siya sa altered total body water and ion osmosis, leading sa electrolyte imbalance. Then, also, yung dehydration causes to decrease perfusion sa brain, spinal cord, and nerves, leading sa body weakness, confusion, and worse, lead to coma and death. Balik po tayo sa absolute insulin deficit. Doon po sa una po. Dahil nga sa lack of insulin to suppress lipolysis. Pa balik nga isa. Thank you.
Wait lang.
Yan, thank you, Jack. So, balik tayo sa absolute insulin deficit. Lack of insulin to suppress lipolysis allow the body to start producing energy from triglycerides. Then stimulates release of free fatty acid from adipose tissue. Then undergo hydrolysis of free fatty acid in the liver where the mechanism ketogenesis takes place. Then magpo-produce po ng acetyl coenzyme A. Yung acetyl coenzyme A participates in biochemical reaction in protein, carbohydrate, and lipid metabolism and used as energy by the starving cell. Dahil nga sa ketogenesis, yung ketone bodies were produced, which is yung acidic energy molecules, which are yung beta-hydroxybutyrate, acetone, and acetoacetate that form and accumulate nga sa blood. Then, excess ketone build up sa blood eventually spill over sa urine na tinatawag na ketonuria. Since accumulated and produced in large amount nga sa blood, it makes the blood acidic. It overwhelms the buffering capacity of the blood plasma, resulting nga sa metabolic acidosis. So, increase yung ion gap, yung sa electrolyte, keto acid consume yung serum bicarbonate. Then, due to metabolic acidosis, disrupted yung enteric turbo system leads to decreased gastric emptying sa ileus part, resulting in abdominal pain, nausea, vomiting. Therefore, increase yung dehydration. Next, sa body, yung body tries to reduce blood acidity by exhaling more CO2. A deeply labored breathing known as cosmal respiration may result. Next is yung breathing of ketones or yung ketone bodies na acetone that causes sweet breath or fruity odor. Then lastly, yung sa metabolic acidosis causes disruption of electrical signaling sa brain, spinal cord, and nerves nga, resulting in body weakness, confusion, coma, or even death. So, nasa baba pala yun. Yung mga nabanggit kong signs and symptoms. Yun lang po. May tanong po.
So no questions. Okay, very good din yung discussion. Okay. Okay, diabetic ketoacidosis, it is actually, tawag dito, a worst case of those who has diabetes. Okay. So malinaw binanggit kanina, you'd proceed with ketoacidosis when you have diabetes. It is plainly because kapag you have diabetes, you are not capable of utilizing energy from carbohydrates. Diba? Kasi hindi ma-consume ng cell yung carbohydrate, yung source ng energy from carbohydrates basically because you are lacking of insulin. So what happens, your body tries to feed your cell, okay? Kasi kailangan niyang kumain eh. So the way para makakain ng cell is to break down energy by the source of your first dapat protein after your carbohydrates. And second, pag wala pa rin talaga, yung cholesterol ninyo. And with the metabolism of your protein and your cholesterol, this release the ketones. Okay? And when ketones is building up too much to your body, that makes your body to be acidic. That's the reason why it's diabetic ketoacidosis. Okay? So na-point out naman niya, na-point out ni Miss, sorry. Sino nga ito nag-report?
Alex po.
Si Miss Almendra, yung mga signs and symptoms. And one of pinaka matatandaan nyo dyan is yung frothy. Okay? Frothy or fruity smelled breathing. It is because of the buildup of ketones. Okay? So, kapag may diabetic ketoacidosis, okay, so masyadong mataas ang sugar, usually nagti 300 to 80 ang lowest na nila. Okay? So, because there's too much build up of sugar kasi nga hindi nakakain ng cell, and then mas nare-reach silang mataas because of the build up of ketones. Okay? So, do you have questions? Okay, so questions. May questions ba to dito? Board exam questions.
Meron po, sir. Wait lang po. Ayaw kasi mag...
Okay. Which of the following is not a sign or symptom of DKA? Again, which of the following is not a sign or symptom of DKA? A. Positive ketones in the urine. B. Oliguria. C. Polydipsia. D. Abdominal pain. Which is not? What's the correct answer? Okay. So the correct answer is B. Oliguria. Nabanggit kanina ni Miss Almendra, sila ay merong anong klaseng urine pattern? Meron silang polyuria. Okay? So, meron silang increased in urine frequency or urine pattern. Okay? So, the reason why they have increased urine pattern in urine, because of the osmolality. Okay? So, because of the build of the ketones, there's a message being sent to your brain that you need to expel out the ketones. And the only way to expel out the ketones is usually through your breath and through your EA. Okay, so that's the reason why you have increased polyuria. Second, you have increased polyuria. It is because you have increased polydipsia. Okay, so you drink a lot of water. So when you are drinking a lot of water, then you have a lot of water to be expelled out through your urine. Okay. Next question. Which patient is most likely to develop diabetic ketoacidosis? A 25-year-old female newly diagnosed with Cushing's disease taking glucocorticoids, a 36-year-old male with diabetes mellitus who has been unable to eat the past 2 days due to a gastrointestinal illness and has been unable to take insulin, a 35-year-old female newly diagnosed with type 2 diabetes, none of the above. What's the correct answer? Okay. So the correct answer is a 36-year-old male with diabetes mellitus. Why? Sabi nga natin kanina, almost package na sa kanya yung mga predisposing factors. First is may diabetes mellitus siya. So kung diabetic nga, eliminate na natin yung Cushing's. Eliminate na natin yung none of the above. Pagpipilian na lang natin yung may diabetes. However, alin dito may pinakamarami pang factors. Okay? Diabetes mellitus, second is hindi siya kumakain. So hindi siya kumakain, wala siyang source of carbohydrates. Ang source niya lahat protein and fats stored in the body, 'di ba? Meron siyang gastrointestinal illness. Okay? So ibig sabihin, aside sa hindi siya kumakain, nag-eliminate pa siya ng energy through gastrointestinal illness, kung suka man yan o pagdudumi. Okay? And fourth, meron siyang insulin skip. Nag-skip siya ng insulin. So the more na kung meron man siya carbohydrates sa katawan, hindi na burn. So kapag hindi, ang choice na natin is gamitin ang inyong protein with your muscle and your fats, cholesterol. So, mas malaki yung kanyang chance na magkaroon ng diabetic ketoacidosis. Question next. A patient diagnosed with diabetes mellitus is being discharged home, and you are teaching them about preventing DKA. What statement by the patient demonstrates they understood your teaching about this condition? A patient diagnosed with diabetes mellitus is being discharged home, and you are teaching them about preventing DKA. What statement by the patient demonstrates they understood your teaching about this condition? A, I should not be alarmed if ketones are present in my urine because this is expected during illness. B, it is normal for my blood sugar to be 250 to 350 while I'm sick. C, I will hold off taking my insulin while I'm sick. D, it is important to check my blood glucose every 3 to 4 hours when I'm sick and consume liquids. What's the correct answer? What's the correct answer? The correct answer is D. It is important I check my blood glucose every 3 to 4 hours when I'm sick and consume liquids. Okay. Why? First is I should not be alarmed if ketones are present in my urine because it is expected during illness. You should be alarmed, not be alarmed. You should be alarmed. Because the fact that you have already present ketones in your urine and you are trying, kapag nag-smell ka sa iyong bibig is parang fruity, then it would tell you that your diabetes mellitus is now being complicated. You are progressing to diabetic ketoacidosis. Meaning, your body is no longer utilizing energy from carbohydrates, but are burning your fats and your protein, your muscles. So you should be alarmed. That's the reason why it's not a correct answer. B, it is normal for my blood sugar to be 250 to 350 milligram while I'm sick. Whether you are sick or not, although kapag sick ka, mas mataas talaga ang sugar mo. Mas mataas ang sugar mo when you're sick, it is because you have greater metabolism to combat your illness or sickness. However, if it's 250 to 350, then it's not normal. You should be alarmed and do something about it. Because when we try to tell the patient that it's normal when you are sick, the patient will not seek for any intervention. Okay? That's the reason why kapag ganyan kataas, it's a natural response, but you should be alarmed. Okay? Because it should be addressed immediately. So that's the reason why it is a wrong choice. C, I will hold off taking my insulin while I'm sick. The more, sabi nga natin, kapag sick ka, mas mataas ang iyong insulin talaga. But you need to address it. And one way to address it is to take insulin. Okay? So you need not to hold off your insulin, but instead the more that you have to use insulin. Okay? As appropriate. Okay? Next question. Tatlo-tatlo lang question yan. Okay. Next reporter, please.
Good evening po. Yung report ko po is chronic kidney disease. So, definition, chronic kidney disease is a condition characterized by a gradual loss of kidney function over time. When a patient has sustained enough kidney damage to require renal replacement therapy on a permanent basis, the patient has moved into the fifth or final stage of chronic kidney disease, also referred to as end-stage kidney disease. So for etiology po, diabetes mellitus and high blood pressure, risk factors, predisposing, meron pong comorbidities, may diabetes na, may high blood pressure, and uh, may obese din po yung patient. For genetic po, may family history of kidney disease, may older age, and for precipitating po, lifestyle. So for the signs and symptoms po for neurologic, asterixis, behavior changes, confusion, disorientation, inability to concentrate, restlessness of legs, seizures, tremors, weakness, and fatigue. For the signs and symptoms po sa integumentary or thinning hair, dry, flaky skin, ecchymosis, gray-brown skin color, pruritus, purpurate, and thin brittle nails. Sa cardiovascular, engorged neck veins, hyperkalemia, hyperlipidemia, hypertension, hypertension, pericardial effusion, pericardial tamponade, pericardial friction, rub, pericarditis, periorbital edema, pitting edema, feet, hands, safe room, pulmonary, crackles, depressed cough, perplexed, small type respirations, pleuritic pain, shortness of breath, tachypnea, thickness, tenacious sputum, uremic pneumonitis. Gastrointestinal, ammonia odor to breath, anorexia, nausea and vomiting, bleeding from gastrointestinal tract, constipation or diarrhea, hiccups, metallic taste, mouth ulceration, and bleeding. Hematologic, anemia, thrombocytopenia, for reproductive po, amenorrhea, decreased libido, infertility, and testicular and atrophy. For musculoskeletal, bone fractures, bone pain, foot drop, loss of muscle strength, muscle cramps, renal, and osteodystrophy. So, yung mga kailangan kong diagnostics, GFR or glomerular filtration rate, creatinine clearance and plasma, creatinine and urea level, tubular function, glucosuria, EUC, CMC plasma, albumin, urine analysis, CT scan for renal artery stenosis or urinary tract obstruction. Ultrasound, small kidney suggests chronic disease and cystoscopy. So for medical management po, medication, phosphate binding agent, and calcium supplements, calcium carbonate or calcium acetate, and sibylene hydrochloride. Antihypertensive and cardiac medications, diuretic agents, inotropic agents such as digoxin or dobutamine, sodium bicarbonate supplements, and recombinant human erythropoietin, epoetin alpha, erythrocyte stimulation therapy, epoetin alpha supplementary iron such as iron sucrose and iron dextran or ferric gluconate. So for anticonvulsant medication po ay diazepam and phenytoin. And for treatment po, hemodialysis and peritoneal dialysis. So for nursing management po, assessment, nutritional status, weight changes, laboratory values, nutritional dietary patterns, diet history, food preference and calorie count, fluid status, daily weight, intake and output, skin turgor, distension of neck veins, vital signs and respiratory effort, understanding of cause or of renal failure, its consequences and its treatment, patients and families' responses and reactions to illness and treatment. Diagnosis, excess fluid volume related to decreased urine output, dietary excesses, and retention of sodium and water, imbalanced nutrition less than body requirements related to anorexia, nausea and vomiting, dietary restrictions and altered mucous membranes, deficient knowledge regarding condition and treatment, activity intolerance related to fatigue, anemia, retention of waste, products and dialysis procedure, risk for situational low self-esteem related to dependency, low changes, change in body image, and change in sexual function. Planning demonstrates no rapid weight changes, maintains dietary and fluid restrictions, exhibits normal skin turgor without edema, exhibits normal vital signs, consume high-calorie foods without dietary restrictions, explain in own words rationale for dietary restrictions and relationship to urea to creatinine levels, verbalizes relationship of cost of kidney disease to consequences, state in own words relationship of kidney disease and need for treatment, reports increased sense of well-being, participates in selected self-care activities, patients and family identify and verbalize feeling and reaction to disease and necessary changes in their life, seek professional counseling if necessary to cope with changes resulting from kidney disease. Intervention, assess fluid status, limit fluid intake and prescribe volume, identify potential sources of fluid, explain to patient and family the rationale for fluid restriction, assess nutritional status, assess patient's nutritional dietary pattern, assess for factors contributing to altered nutritional intake, assess understanding of cause of kidney disease, consequences of kidney disease, and its treatment. Provide explanation of renal function and consequences of kidney disease at patient's level of understanding and guided by patient's readiness to learn. Promote independence in self-care activities as tolerated. Assist if fatigue. Encourage alternating activity with rest. Assess relationship of patient and significant family members. Assess usual coping patterns of patients and family members. And for evaluation, patient demonstrated no rapid weight changes. Patient maintained dietary and fluid restrictions. Patients exhibited normal skin turgor without edema, exhibited normal vital signs, and patient consume high-calorie foods without dietary restrictions, and patient is able to explain in own words rationale for dietary restrictions and relationship to urea to creatinine levels. And patient verbalized relationship of cause of kidney disease to consequences. And patient can state in own words the relationship of kidney disease and need for treatment. Patient reports increased sense of well-being. Patient is able to participate in selected self-care activities. And family identified and verbalized feelings and reaction to disease and necessary changes in their lives, patient is willing to seek professional counseling if necessary to cope with changes resulting from kidney disease. So, for pathophysiology po, uh, chronic kidney disease po, it can also referred po as chronic kidney failure. So, uh, so each of our kidney po is made up of about a million filtering unit. And yun po yung mga nephrons. So, a nephrons is the basic structural and functional unit ng kidney that regulates water and soluble substances in the blood by filtering, reabsorbing what is needed and excreting the rest as urine. So, each nephron po merong filter, yun po yung glomerulus and tubule. So, glomerulus po, siya po yung nag-filter ng blood. And tubule, nire-absorb niya po yung mga kailangang substances ng blood. And marami pong dahilan kung bakit nagkakaroon ng chronic kidney failure. And this include po, halimbawa po yung patient na-diagnose na ng merong acute renal failure, and alam naman po natin ng acute can lead to chronic. Meron ding may diabetes, may hypertension, at meron pa pong iba pang kidney diseases like polycystic kidney disease. And lahat po yun can lead to irreversible loss of nephrons, which is the chronic kidney failure. So, dito po muna tayo sa acute renal failure. So, pre-renal causes, renal artery, stenosis, heart failure, hemorrhage, and halimbawa po yung patient, dito po sa pre-renal failure, halimbawa po yung patient nagkaroon ng abdominal surgery or nagkaroon siya ng severe infection or injury, kaya po may severe blood loss at low blood pressure. And for intrarenal causes po, glomerulonephritis, tubular nephritis, interstitial nephritis, and post-renal causes, benign prostatic hyperplasia, renal stones, and tumors. And lahat po yun will lead to loss of nephrons. And dito naman po tayo sa halimbawa po, yung patient is may hypertension. So, ito po yung nangyayari kapag may hypertension. So, yung head po ng nephron, the Bowman's capsule, doon po nag-enter yung blood vessel. So, when someone has hypertension, it causes thickening of the blood vessels, and which leads to narrowing of the lumen or afferent arteriole. So, because of the narrowing of the lumen, less po yung blood flow, kaya po decrease siya decrease yung blood flow to the kidneys and through the nephrons. Decrease din po yung glomerular filtration rate. So, ayun. So, dahil po less yung blood flow, dahil sa hypertension, kapag po decrease yung blood flow sa nephrons, may mga cells po na nadidetect and nag-start po siya mag-produce ng renin, and which subsequently leads to the activation of the RAAS or the renin-angiotensin aldosterone system. So, dito po sa system ng RAAS, ini-increase na po yung heart rate and further hypertension kasi konti lang yung dumadaloy na blood. So, iniisip ni kidney, parang mag-increase siya ng blood pressure para makareceive siya ng more blood, at lalo po yung madadagdagan yung pag-narrow at pag-thicken ng blood vessels. Kaya nagkakaroon po ng glomerulosclerosis, which is thickening and hardening of the blood vessels in Bowman's capsule. And hindi po siya maiwasan, kaya mapupunta po sa ischemic injury and the loss of nephrons. And at dito naman po sa diabetic, kapag diabetic po yung patient, dahil po sa risk factors, include hypertension, nadidevelop po ang diabetes. So, diabetes is a condition where you have high blood glucose and will leads to overproduction of reactive oxygen species or the ROS and leads to activation and production of growth factors, pro-inflammatory cytokines, and oxidative stress, and all leads to for diabetic nephropathy changes. So may nagkakaroon po ng sclerosis, mesangial expansion, and proliferation, podocytopathy, hypertrophy and atrophy, and glomerular basement thickening, and all leads to loss of nephrons. So next po, sa sodium and water balance po. So kapag decrease po yung GFR and leads to sodium and water retention, kaya po nagkakaroon ng high blood pressure and peripheral edema. So kailangan po restrict yung fluid intake kasi delikado na po yun para maiwasan po yung further loss of vomiting at diarrhea. And next po yung potassium balance. So decrease po yung pag-decrease po yung GFR, nagkakaroon po ng potassium retention and nagre-result po ng hyperkalemia and nagkakaroon po ng muscle weakness. Kaya nagkakaroon din po siya ng changes sa ECG and cause fibrillation. So kapag po loss of nephrons, decrease po yung renin production and decrease po yung aldosterone, and distal sodium-potassium pump does not work. Kaya nagkakaroon po ng potassium retention, and potassium-sparing diuretics, ACE inhibitors, can further aggravate a problem because you're promoting more potassium. So next po sa metabolic acidosis, diminished capacity to excrete hydrogen generate by carbonate, kaya po nagkakaroon ng acidosis and bone decalcification. And nephrons po kasi responsible for maintaining for our body and it produced by carbonate if necessary or to secrete hydrogen ions. So for minerals balance po and osteodystrophy, so kapag po loss of nephrons, decrease po yung calcitriol, and decrease po yung calcium reabsorption, kaya po nagkakaroon ng hypocalcemia, and secondary to hyperparathyroidism. So, yung calcitriol po, ini-stimulate niya po yung parathyroid gland, kaya po nagkakaroon ng hyperparathyroidism and leads to osteodystrophy because of the parathyroid hormones that stimulates bone breakdown. So, sa other manifestation of dito naman po sa uremia, essentially a lot of urea in the blood. Urea normally excreted by the kidneys in urine. So the vasorecta po are the blood vessels are responsible for secretion of substances into the nephron and reabsorption of substances from the nephrons. And sa last part po ng nephrons, the urea is absorbed into the vasorecta and siya po yung tumutulong para mag-drag ng water sa vessels. So urea, masisecrete niya pabalik sa nephrons and yung water po doon, nag-stay lang siya sa vessels dahil yung sodium din po ay also reabsorbed. And kapag lahat ng process po na yan ay hindi nag-work, mariretain lang dun yung urea kaya po nagkakaroon ng uremia, and it results in neurological signs and symptoms. Yan lang.
Okay. So, detailed din naman yung pathophysiology ni Miss Haka. Okay. So you all know for a fact naman na medyo forte ko yung CKD. So, na-explain naman niya. I believe almost lahat ng group niyo na paliwanagan ko na rin regarding sa RAAS. So, almost lahat nung sa chronic kidney disease, ang great affectation niya is of course your RAAS system. Okay? So, do you have any questions? Okay, so if there's none, ano yung board exam questions ni Ms. Haka? A patient with CKD has a low erythropoietin level. The patient is at risk for. A patient with CKD has a low erythropoietin level. The patient is at risk for A. Hypercalcemia, B. Anemia, C. Blood clots, D. Hyperkalemia. The correct answer is okay. No-brainer. Ang sagot talaga is anemia. Okay, so nakita niyo na low erythropoietin. So low, alisin na natin yung hyper. So lahat ng hyper eliminated, A and D. So maiiwan na lang natin anemia and blood clots. But however, since mababa nga ang erythropoietin, we know okay? We know it's red blood cells, okay? And anemia is about red blood cells, then the correct answer is anemia. For blood clots, it's platelet dapat. Per erythropoietin pinag-uusapan. Next question. Which patient below is not at risk for developing chronic kidney disease? Is not at risk. Okay? Yung sinasabi niya, which patient is not at risk for developing chronic kidney disease? A. 58-year-old female with uncontrolled hypertension. B. A 69-year-old male with diabetes mellitus. C. A 45-year-old female with polycystic ovarian disease. D. A 78-year-old female with an intrarenal injury. What's the correct answer? C. C. Galing ng mga laging tama sagot. Okay, so the correct answer is letter C. So we all know for a fact the letter B, high na ang kanyang risk. Because the number one leading cause of diabetes is uncontrolled diabetes mellitus. So B is risk. So that's a that's a wrong answer kasi ang hinahanap natin ay not at risk. Number two, IA. Why? Kasi we all know for a fact that the second highest reason for diabetes is uncontrolled hypertension. So A is eliminated. D, merong intrarenal. Okay? So intrarenal. So the term intrarenal, ibig sabihin meron ng problema sa kidney. So there's a greater chance na magkaroon siya ng problema ng chronic kidney disease. Now, totoo ba na ang 45-year-old female with polycystic ovarian disease is not at risk? The answer is no. Okay? A 45-year-old with polycystic ovarian disease has also a risk of having chronic kidney disease because kapag meron kang polycystic ovarian disease, okay, the cyst, okay, can is not migrating, okay, pero with the multiplication of the cyst, kaya nga polycystic, okay, pwede siyang mag-outspurt at mag-grow na pwede niyang maipit ang kidney. Because remember, your ovary is almost adjacent near to your kidney. So, merong risk. But compare among the among the four, siya ang may pinaka-least na risk. Okay? So, kaya siya ang best option. And the correct answer is C. Okay? May question pa dyan? May kasunod pa yung tanong? Okay, 3. The kidneys are responsible for performing all the following functions except A. Activating vitamin D, B. Secreting renin, C. Secreting erythropoietin, D. Maintaining cortisol production. And the correct answer is okay. So the correct answer is D. Okay? So alam natin na activating vitamin D is part of the function of your kidney. Remember the ano nga ito, dihydroxycalciferol? It is being released or secreted by your kidney, which is responsible for the activation of your vitamin D absorbed in the gut. Secretory renin, RAS system, so it's the kidney that functions. Production of RBC, kidney secretes erythropoietin, sending message to your bone marrow to produce more RBC. So the correct answer is cortisol. Although cortisol is actually a cascade, cortisol production is a cascade effect, okay, of the activation of vitamin D. Because when vitamin D is being activated, okay, the calcium is being regulated. And when the calcium is being regulated, cortisol production is being regulated. But, ang tanong, yung directang function ng kidney. So, the direct function of the kidney in the cortisol production is activation of vitamin D. So, therefore, maintaining cortisol production is just a cascade event of the activation of vitamin D by the kidney. Okay? So the correct answer is D. Kasi exempt. Okay, so that's all. Next reporter.
Si Migs na
si
po,
Migs na.
sir.
Can we move with
Opo.
other group to report today? Or you prefer to have it tomorrow?
Wala pa po kayong nagsasabing next na magre-report, sir.
Hindi, yun nga, bubunot ako if ever.
Bukas na lang po, sir.
Bukas na lang. Okay, so tomorrow, please advise, sige, bukas kahit hindi na pala gumawa si Mix ng kanyang video, siya yung first magre-report bukas if meron na siyang internet. But if wala pa rin siyang internet, ngayon po bubunot. Okay, I'll make bunot. Okay, so kung wala pa rin siyang internet bukas, please advise him to do the video. But if not, okay, tomorrow.
When daw po yung deadline kapag wala pa rin po siyang internet?
Wala siya internet, pero nakapag-message sa inyo, ha? Text. Anyway, the deadline would be, of course, up until Friday. Friday. Okay? Wait lang, bubunot ako, ha? Ah. And anong group? Wait lang. Pang fifth reporting na natin, no? Am I correct? Okay, so for tomorrow's report, ang ire-report ay tama ba? Cholecystitis, pelvic inflammatory disease, systemic lupus erythematosus, and the group is Group F. Nakuha? Hello?
Yes
Okay.
po, sir.
Group F. Anong tanong, Andre? Andre, may tanong daw, di naman tinatanong. Tanong mo na. Diyos ko, di yata natin estudyante yun. May sapa ka na namang Gillian na. Pinaasa mo ako. Okay. So, see you tomorrow. Please advise Migs. Okay? If ever na hindi, up until Friday, I'll be waiting for the video. Okay? So, after tomorrow, we only have 3 more groups left. Okay? So, hopefully matapos na natin itong MS within this year. Kasi, ano naman, para maagang matapos yung SEM natin. Kasi yung UP nga, tinatapos na yung SEM. Sana ganun din ang CBC. Okay? Okay. Do you have any other questions? Reactions, violations, recommendations? Do you have any? In 5, 4, 3, pwede po. Ano? Pinagdugtong-dugtong. Pwede po, hahaha, sir. Malaman na po. Ano? Ano daw? Kung sino po yung F niya, sasaktan kita dyan kakasabi ko lang kanina. As for remaining topics, wag na. Tatlo na naman to, bukas na lang. Bukas, I'll be telling you, since plan natin tapusin, kung tatlong remaining topics na lang by next week, dapat tapos na. Ha? Okay? And, after nun, pati yung oras ng MS, puro research na gagawin natin. Okay? But, yung oras na yun, it's not a formal discussion. It would be more of consultation na lang. Okay? And I'll be ingesting my my comments and discussion. However, kung makikita niyo, medyo magkaiba kami ni Ma'am Dakis ng atake sa research, ha? Kaya lang, if you are doing research is not as simple as writing a research lang, because you have to meet a certain standard. But to be honest, hindi natin establish kung ano talaga yung standard, because standard, okay, varies among sino ang uupo or sino yung babasa. Okay? Wala talaga established standard kasi iba-iba talaga ng pananaw pagdating sa research. But if you are to comply to a certain standard, okay, it should be Ma'am Daki's standard. Okay? So kung meron akong i-offer sa inyo na ganito gawin ninyo, but that's against the thought ni Ma'am Dakis, yung kay Ma'am Dakis ang susundin ninyo. Okay? But if I see that meron akong suggestion that is really applicable and it's really needed, I will be fighting that to Ma'am Dakis. Okay? Para maging okay yung inyong research. Okay? So for MS ngayon, we'll meet tomorrow. I've said na kung ano gagawin natin tomorrow. And I'm not sure kung tama ba talaga na hindi ako bigay sa inyong rip ng Okay. Noted, Jessa. I'll read that. Okay, so hindi ko pa alam kung tama ba na hindi ako magbigay sa inyo ng exam. However, I do trust your capacity and your initiative. Okay? Because online learning talaga is a very difficult mode para magturo. Okay? And in a way, matuto. Okay? So, the only way for you to learn best is to do your own initiative of learning. Kaya ayoko rin naman mag-gauge kayo through exams. Well, in fact, I'll be honest, I believe I didn't deliver it well in this manner. Okay? So it would be unfair for me to conduct an exam. Okay? Kung may measure ko naman yung initiative ninyo, okay, it would be unfair sa sarili ko that I tried to gauge your initiative, me, okay, not being fair to everyone. because there are some who are privileged and there are some that, that are not. So, might as well hindi na lang. So, I'm basing all your grades to your attendance, to your reports, to your group effort, and to your narrative. Okay? Is that fair? Yes, sir. I think that's fair. No, sir. That's not fair. Okay. So, anyway, should you have any concern, okay, regarding not just only MS but also research or suggestions, feel free to tell me. Don't be hesitant. Kung negative yung gusto nyo sabihin, don't be hesitant, okay? Tell it to me. No problem, okay? Okay. Okay, sir. Okay. So, see you tomorrow. Let's meet by tomorrow. Ulit, sorry ha. Medyo flexi kasi yung time ko. Minsan 4, minsan na-adjust ng 4:30. Medyo busy lang talaga. Okay? So, I'll tell you ulit kung anong oras tayo tomorrow. But roughly, tentatively 4 p.m. Okay? See you! Have your dinner. Thank you, thank you.
Thank you po, sir. Bye
Bye-bye.
po.
Nakita
Thank you, sir.